So hello everyone, this is Tomas Urbanek. I'm Doctor of Physical Therapy, and what we're going to do today is talk about recommendation for our youth, kids 6 to 17, to see what American Heart Association has to say, CDC has to say, and American Academy of Pediatrics in regards to the physical activity recommendation for our youth health. So going with CDC first. So ages 6 to 17, CDC recommends that each youth or each individual kid participate in at least 60 minutes of moderate activity 7 times a week, or vigorous activity for 60 minutes 3 times a week. Muscle strengthening activities should be done at least 3 times a week. So there's a little bit of a misconception about what moderate and vigorous activity means. You can send us a message on either through our social media, Instagram or TikTok or YouTube, and we'll help you figure that one out. But it's essentially what it is. It's based off of a kid's heart rate. Certain heart rate range will be counted toward moderate activity versus obviously much higher heart rate will be counted as a vigorous activity. So now going into American Heart Association's very similar recommendation for the youth ages also 6 to 17. They recommend actually moderate to vigorous activity, so kind of mixture of both, or anything in between 60 minutes a day every day of the week. So that's some pretty serious recommendations out there. And lastly, we're looking at American Academy of Pediatrics. This specific source recommends the activity for ages 5 to 21, so a wide range of kids out there to young adults. They recommend moderate to vigorous activity, at least 60 minutes, 7 days a week, so the same as the American Heart Association. And also they recommend muscle and bone strengthening exercises at least 3 times a week. So those are 3 big sources that look after the health of your child, and each of them essentially recommend that your exercise routine or your child's exercise routine, it's pretty vigorous 3 times a week, or it's very frequent and it's moderate to 7 times a week. Now those people who live in rural areas, they probably won't worry about it because their kids are outside running around all day, and that itself might meet the recommendations. But for most of us that live within the cities, that don't feel comfortable letting our kids kind of stroll on their own and play with other kids without supervision, this might be something that we look into it. Now, when I look at the sources, there is obviously the risk of not having your kids participate in the recommendation of CDC, American Heart, and Pediatric. Is obviously the same ones as adults: the heart disease, the increased stress, obesity, hyperlipidemia, hyper blood pressure, depression, and things like that. But more interesting, what I found, the things that you don't think about, but kids are really exposed. If they don't get enough activity, they are exposed on things like irritable mood, they have reduced creativity, they have low confidence, and they're high risk for mental health issues. So something that it's easy overlook is really not getting the kids enough activity or as much as they should. So I think if you are listening or watching this video, I would recommend you that you get your kids out there, get them exercise, sign them up for any type of classes, go play ball with them, go run around, do something with them. Please keep them healthy. Thank you so much.